Hello, I am Dr. Mirela Cerneianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome to another episode, and I'm going to continue my series on female pelvic organs. And this episode is dedicated to the fallopian tube. The female fallopian tubes, men don't have these, are a very essential part of our feminine reproductive system. These are two thin and very soft tubular structures that are about 4 inches long, and they play a crucial role in the process of fertilization and the ability to bear a child. They are responsible for transporting a woman's eggs from the ovaries to the uterus, where finally the fertilized egg can implant and find a home for 9 months. The fallopian tube starts from the top of the uterus, which we call the uterine fundus, and kind of drapes over the ovary with the fimbriated end that looks like a trumpet. So it's a long, thin tube ending with this large dilated part of the tube, which is looking like a trumpet. But this last part of the tube, the one towards the ovary, the fimbriated end, is not solid like a trumpet, but it's made out of these small, delicate little tendrils, almost finger-like, which we call fimbria. And their job and function is to grab, without missing, the egg that is released by the ovulating ovary on that side. There's a tube to match each ovary. Once the egg is grasped by the tube is responsible for providing a very important feeding and nourishing environment, which supports this egg while it travels through the tube towards the uterus. Now, this is a very short but very important journey. And within the time that the egg spends in the tube, the egg will actually meet the sperm when it's in the tube. The egg will be normally fertilized while it journeys from the fimbriated ovarian end of the tube to the uterine cavity. So obviously, without a well-functioning fallopian tube, a woman cannot and will not get pregnant. So just to recap, the tube has to grab and retrieve the egg, move it, but what we call peristalsis. The tube actually has smooth muscle that contracts and creates a wave-like movement, pushing and propelling the egg towards the sperm. And once the egg is fertilized, it's propelling it towards the uterus. Now, this fallopian tube also, again, nourishes the egg and the sperm, both of them, until they meet. And usually this meeting point is in the outer third portion of the tube, really close to the ovary. And again, that's where the fertilization process of the sperm entering the egg actually happens. And once the egg is fertilized, it will have to be propelled and pushed towards the uterus, and it will also have to be nourished. And then once inside the uterus, this egg has to remain viable for that journey, which is anywhere from a few days to about 4 or 5 days. And that's why the tubal role and function are very important. And when the egg is in the uterus, the tube is done. Okay? So without a well-functioning, without a tube that moves properly, that is providing a nourishing environment for the egg, a woman cannot get pregnant. So obviously these fallopian tubes, again, one on each side, play a very crucial role in our process of conception. And these two little slender tubes, one on each side of the uterus, between the uterus and the ovary, are the pathway through which an egg travels from the ovary to the uterus. So I'm going to detail a little bit more what the fallopian tube role is in fertility. Number one, it's for egg transport. It is to capture the egg that's released by the ovary during ovulation. And again, these finger-like projections that are right at the end of the fallopian tube that kind of covers the ovary almost like a little glove. They sweep the egg into the tube shortly after it's released, and then the egg slowly moves through the fallopian tube towards the uterus. Another role for fertility for the fallopian tube is fertilization site. It's a fertilization spot. So that's number two. The fallopian tubes would provide the ideal environment for the fertilization to occur. This fertilization does not occur in the ovary and does not occur in the uterus. As the egg travels through the tube, it will likely encounter the sperm that has traveled through the cervix and the uterus, and the meeting point between the egg and the sperm, it's actually in the tube. And again, the fertilization occurs in the fallopian tube once the sperm successfully penetrates the egg and it forms an embryo. So then brings us to number three, role for the tube. It's embryo transport. After fertilization, this fertilized egg, which is now an embryo, it starts to divide and develop immediately. Again, this embryo will continue its journey through the fallopian tube towards the uterus, where it needs to be for a viable pregnancy, and it will implant in our uterine lining for further growth and development. But that short couple of day to 4 or 5 day journey inside the tube is crucial. And in these couple of days, it needs a perfect environment to nourish its development and cellular division, because the embryo will continue to divide and grow in its journey until it reaches the uterus. So it needs to be in a certain phase of development in order for it to implant in the uterus. And that process from egg to fertilized egg to embryo actually happens in the tube. And this, again, is number four. It's a nutrient environment. So these fallopian tubes facilitate this production and exchange of, call it hormones, but mostly nutrients, which are very necessary for the early development of the embryo. So now that we talked about what the tube does in detail, and hopefully you understand exactly how important the tube is, what I'd like to do next is discuss problems that can happen and explain how these fallopian tubes can be subject to different troubles and problems and disease, which can ultimately impact the woman's fertility. So I will come back and linger on the most important ones, but first let me enumerate them and give you the top 10. Number one, salpingitis, inflammation of the fallopian tubes. Number two, tubal obstruction. That's a big one. I'll come back and talk more about it. Number three, hydrosalpinx. That's another big one. It's pretty common. Number four, ectopic pregnancy. I'll dedicate a few words to this as well. Number five, tubal adhesions. Number six, tubal ligation failure. Number seven, endometriosis. Number eight, pelvic tuberculosis, which is rare. Number nine, fallopian tube cancer. That's also a very rare gynecological cancer. And number 10, a torsion of the fallopian tube. So let me just go one by one and say a few more words. Number one, salpingitis is the inflammation of the fallopian tubes. This is usually the result of an infection. It's particularly a sexually transmitted infection like chlamydia and gonorrhea. Also PID, or pelvic inflammatory disease. It's a really big cause for salpingitis. Why do we care about that? Because it can lead to scarring, adhesions, and potential blockage of the tubes. Which brings me to number two, tubal obstruction. What is tubal obstruction and why is it so important that it has its own category? Well, tubal obstruction occurs when the fallopian tubes are partially or completely blocked. So it's preventing this passage, this journey of the egg from the ovary to the uterus. And there are various causes. And like I said, I'm going to detail it in a little bit once I'm done with all these 10 causes of pathology. Number 3, hydrosalpinx. This is a condition in which the fallopian tubes are filled with fluid, either one on one side or both on both sides. Usually it's happening because there's a blockage at the end of the tube towards the ovary. It usually impacts fertility because it interferes with the transport mechanism and the nourishment of the eggs and the embryo. Number 4, ectopic pregnancy. This is when a fertilized egg will implant outside the uterus, often in the fallopian tube. This is always a medical emergency due to the risk of tubal rupture and internal bleeding, and I'll talk more about this in a little bit. Number 5 are tubal adhesions. Adhesions are bands of scar tissue that can form either within the fallopian tubes as a result of inflammation, surgery, infection, or outside the fallopian tubes, between the fallopian tube and the ovary, between the fallopian tube and the uterus, between the fallopian tube and intestines or pelvic side walls. These outside adhesions can disturb the tube's shape and obviously impair its function and cause a blockage. Number 6, tubal ligation failure. This is rare, but it happens and it's a thing. That's why when a woman ties her tubes, we tell them there's a 1% chance of pregnancy afterwards. It is a surgical method of permanent contraception. However, in some cases, these fallopian tubes may reconnect or form an opening, a communication that allows for an unintended pregnancy, and that's a tubal ligation failure. Most tubal ligation failures are actually inside the uterus, but tubal ligation failure, it's a very common cause for tubal pregnancy, which is ectopic pregnancy. And again, I'll come back to that. Endometriosis is number 7, and this is a condition where tissue similar to the uterine lining will actually develop and grow outside the uterus, on the surface of the uterus, on the surface of the pelvic side walls, on the surface of the tubes, on the surface of the ovaries. When this endometrial tissue will affect the fallopian tube, it will clearly cause problems leading to inflammation, scarring, and blockages. I will talk quite a bit about endometriosis in a separate episode, so I won't dedicate any time talking about endometriosis of the tubes because I will dedicate that time in the endometriosis podcast. So stay tuned for that. Number 8, pelvic tuberculosis. It's a very, very rare form of extrapulmonary tuberculosis, so tuberculosis that does not develop in the lungs. This can actually affect reproductive organs, and after the lungs, believe it or not, this is one of the most common places where tuberculosis can nestle and create a problem in a woman. And obviously, it can affect the fallopian tubes. So a tuberculosis infection will cause tubal blockage. Adhesions will clearly impair fertility. Number 9, fallopian tube cancer. It's again very rare type of gynecological cancer that usually originates in the fallopian tube, manifesting with abnormal vaginal bleeding, pelvic pain, bloating. And it's very important that we detect it early because most of these cancers are usually advanced and late stages when we diagnose them. So having any kind of awareness that something's wrong with your period or something's wrong with your belly and it doesn't feel right would hopefully prompt you to go to the physician that's taking care of you to have an ultrasound ordered or a CT scan to look at your tubes. And number 10, torsion of the fallopian tube. The fallopian tube torsion is when the tube twists on itself. It is causing an obstruction of blood flow and obviously potential tissue damage. It's very rare, but it's serious. It might require surgical intervention to detorse or unobstruct, remove the obstruction on the blood flow due to the twisting. And occasionally, we can allow the tube to reperfuse, but most of the times the tube will have to be removed because it's likely compromised. So let me talk about the top 3 most important things about these fallopian tube conditions that you should know as a woman. The most common issue that's very important in young women or women of reproductive age is the blockage of the fallopian tubes. This type of condition will prevent the eggs and the sperm from reaching each other, or can actually prevent the fertilized egg from reaching the uterus. Remember, I said the tube is a conduct that needs to transport the egg. So any blockage that will happen will lead to infertility, as the egg either cannot be fertilized, or if it's fertilized, it usually gets stuck, which is another issue we will talk about, that's ectopic pregnancy. So blockages can occur most commonly due to infections, scar tissue, all kinds of problems, surgeries. So let's talk about the possible mechanisms of blockage of the fallopian tube. Well, the most frequent reason why your fallopian tubes will be blocked or not functioning properly is an infection. Pelvic inflammatory disease or a sexually transmitted infection like chlamydia or gonorrhea can lead to inflammation and scarring of the fallopian tube, resulting in a blockage. The inflammation process that is caused by an infection, which can cause scarring and damage of the fallopian tube, will either lead to a blockage or will alter its ability to function normally. Remember, the tube needs to nourish the egg on its journey to the uterus. So if the lining of the tube is damaged, it will not provide the nourishing environment needed for egg transport and nourishment. So the egg is not going to make it at all, or will simply get stuck in the tube. So infections are bad for the tube. Number 2, endometriosis. Just a few words. I will dedicate a full podcast to this condition. This is, again, a condition where the tissue similar to the uterine lining, called endometrium, grows outside the uterus. This can affect the fallopian tube's function and can cause blockages. And for some reason, these endometriotic lesions cause so much inflammation around the tube and the ovary that the cascade of inflammatory factors released by these lesions can actually damage the environment the egg needs to be nourished in. The egg does not survive. It can actually be killed because some of these inflammatory byproducts are actually toxic. So again, the inflammation caused by endometriotic lesions can be really toxic for the eggs. There's also some form of mucus or debris accumulation caused by the endometriosis inflammation, which can obstruct the passage of the egg, the passage of the sperm, or both. Number 3 mechanism of blockage is previous surgeries. Surgeries like any kind of pelvic surgery, appendectomy, a cesarean section, will result in adhesions, which is band of scar tissue, or any scar tissue formation that will interfere with the normal mobility and the fallopian tube's ability to propel and move the egg towards its final destination, the uterus. So surgeries could be a cause of blockage. Number 4, structural changes. I talked about how surgery can cause structural changes and scarring around the tube, which is altering the shape and functionality. But there are women who are born with abnormalities in the anatomy of the fallopian tube. They could have extra long tubes, which will lead obviously to a tubal pregnancy because the egg needs to traverse a very long segment of the tube, doesn't make it to the uterus, right? So these anatomic variations in shapes can result in different changes that would block the tube or interfere with the movement of the egg. Number 5 is tubal ligation. This is a main reason for tubal blockage. Now, we want the tubal blockage caused by tubal ligation because tubal ligation is a surgical procedure for permanent contraception. Women get this procedure so they don't have any more children. However, tubal ligation can sometimes result in unintentional fistulization of the fallopian tubes. So this is a process in which, amazingly, the cut-off ends of the tube find each other again and form some sort of a bridge through which the sperm can pass to fertilize the egg. But then the fertilized egg might not be able to pass towards the uterus and will get trapped, leading to an ectopic pregnancy. Number 6, there are other factors. Like I mentioned, congenital anomalies, pelvic tuberculosis, even birth control methods like the Mirena IUD can contribute to fallopian tube slowdowns and blockages, which ultimately are bad because they either lead to infertility or ectopic pregnancy. So I talked about how the tubes get blocked. Now let's talk for a second about how do you know that your tubes are blocked or that your tubes are not working well? Well, are there any symptoms and how do we diagnose a tubal blockage? And here's the thing. Fallopian tube blockage may not present with any specific symptoms. You just don't know that you have it until you have a problem, which means you try to get pregnant, you can't, you have a test and you're told your tubes are blocked. But some women may experience pelvic pain randomly that's not related to their periods. They might experience chronic pelvic pain, irregular menstrual cycles, and painful periods, unusual discharge, and obviously infertility. They just simply cannot get pregnant. How do we diagnose and how do we know that your fallopian tubes are blocked? What is the test for that? We usually need an imaging test. That's called hysterosalpingography. So hystero for uterus, salpingo for the tube, graphy is the imaging. So it's an imaging of the tubes and ovaries where the radiologist will canalize your cervix, put a little tiny tube inside your cervix and push a fluoroscopic dye, which then is observed through an X-ray, how it progresses into the uterus, through the tubes, and whether it opens up and spills into your abdomen, meaning your tubes are open. There's also something called saline infusion sonohysterography, where sono for ultrasound, hysterography for imaging of the uterus. That's when the same type of cannula is actually placed through the cervix, and then there's water pushed into your uterus, and then an ultrasound is done transvaginally to look at the progression of water, and you can actually see this progression, distend the uterus, you identify polyps in the uterus. It's not that good at looking at the tubes, not as good as the hysterosalpingogram, so it's not really the gold standard. But if you have a very experienced sonographer with a very good technical skills of actually introducing the fluid and good skills at watching the fluid go through the tubes, that could be a valuable tool. And last but not least, laparoscopy. That's when we make a little cut in your belly button, put the camera through, and we take a look and we see visually how your tubes look. And there's a little dye that's also pushed, that's a colored blue, that's methylene blue, that's actually pushed through a manipulator into the uterus and then out through the tubes. And that is a procedure called chromoperturbation that's done at the time of the laparoscopy. This type of procedure can visualize your fallopian tubes and identify blockages or abnormalities. So we talked about how do we get a tubal blockage? How do we diagnose it? Well, how do we treat it? Well, it depends on the underlying cause and severity of the blockage. So options may include a surgical intervention. In cases of very severe blockages, a surgical procedure like a laparoscopy, where we do something called tubal cannulation, trying to dilate the tube, or maybe we want to repair, like cut, excise the bad area, and reanastomose, put together end to end the fallopian tubes. A tubal ligation procedure can be reanastomosed or sewed back together. And in some cases, the tubes are so severely damaged, they will need to be completely removed. Now, that means a woman without tubes can only get pregnant through IVF, in vitro fertilization. And for women with extensive tubal damage or blockages that cannot be repaired, IVF is awesome, is why modern science comes to save humanity. It can bypass the fallopian tubes because it's retrieving the eggs using an ultrasound-guided needle and a syringe directly from the ovary. Then the eggs get placed in a petri dish with the sperm in the laboratory that allows fertilization. And once the embryo achieves a certain stage of development, which is supervised with electronic microscopy, then it is transferred to the uterus. So to recap, fallopian tubal blockage, managing it is essential for women trying to conceive because having a blocked and non-functioning tube can significantly impact fertility. So early detection, accurate diagnosis, and very appropriate treatment options that are tailored to individual circumstances obviously will help address appropriately a fallopian tubal blockage and optimize the chance of a successful conception. If a woman has blocked tubes after menopause, it doesn't matter. We sometimes don't even know about it. We have an incidental finding, which kind of looks like hydrosalpinx. So the tubal blockage is really important in young women who want to conceive. So obviously, having a conversation about tubal blockage is not complete without explaining a very important tubal condition called hydrosalpinx. Because hydrosalpinx is a condition characterized and defined by the accumulation of fluid in the fallopian tube. So the fallopian tube is distended with tubal fluid, and obviously this has very potentially negative impacts on fertility. So let's discuss hydrosalpinx, the symptoms, the cause, and treatment options. First of all, what are the symptoms of hydrosalpinx? Well, most of the time, the hydrosalpinx in a woman is asymptomatic. It's usually discovered incidentally during a fertility evaluation or an imaging study, like an ultrasound, when we might find a cystic structure that is ovoid in shape. It's not round, like a cyst. And it's usually either next to the uterus or next to the ovary or in between the uterus and the ovary. Another sign that a woman might have a hydrosalpinx, it's pelvic discomfort. Some women may experience mild to moderate pelvic discomfort or have the sensation of pressure, might even possibly experience pelvic pain, but that's rare. Most hydrosalpinx is asymptomatic. Abnormal vaginal discharge from hydrosalpinx is not often or common, but in some cases, a woman can have either persistently clear or slightly yellowish mucousy discharge. Menstrual abnormalities could be caused by having a hydrosalpinx. So it can cause abnormal bleeding patterns. So having an ultrasound is crucial every time you have an abnormal bleeding pattern. The number one symptom of hydrosalpinx is actually infertility. Again, hydrosalpinx, the dilated fallopian tube filled with fluid, is very commonly associated with infertility or recurrent pregnancy loss because obviously there's an impaired tubal function, and this fluid is actually full of toxins and pretty bad for the uterine environment, and it does spill into the uterus, which can impact the ability of the embryo from the other side to actually functionally and successfully implant and create a viable pregnancy. So what are the causes? Why do we get hydrosalpinx? Well, number one is pelvic infection. Prior pelvic infections from sexually transmitted infections like chlamydia or gonorrhea will cause tubal scarring. It can actually cause closure of the fimbriated end, the trumpet-like end with finger-like projections, which closes off and can no longer catch the egg. But at this point, the tube has no way of allowing the passage of secretions from the uterus or blood to the peritoneal cavity. And then the fluid and the blood can get trapped in the tube when a woman has hydrosalpinx. So again, a history of PID, pelvic inflammatory disease, can also explain tubal damage and hydrosalpinx development. And women that have PID, it's not unusual that 2 or 3 years after PID, they're diagnosed with hydrosalpinx. Endometriosis is a very important and very possible cause of hydrosalpinx. The endometriosis-related inflammation and adhesions will affect the fallopian tube, contributing to fluid accumulation. Previous surgeries, any pelvic surgery, especially those that involve the fallopian tube, or surgeries that involve nearby tissues, the ovary, the uterus, the pelvic organs, the colon, the small intestine, the appendix, etc., may increase the risk of hydrosalpinx formation. So what are the treatment options? Well, surgical intervention is a very valid treatment option. We can talk about something called salpingostomy. So we create a new opening. The hydrosalpinx is reopened, it's drained. So this is done to reduce fluid accumulation, to restore tubal patency. And obviously it can be considered in select cases, but it's rarely a solution because the problem is not the accumulation of fluid. It's usually the fact that the quality of the lining of the tube that causes the hydrosalpinx is damaged, is not functioning well. And opening scar tissue, it just means that you're giving the opportunity to the body to reform that scar tissue. So there's a 80 to 90% chance that scar tissue will reform. So just simply opening the tube again doesn't mean it won't close up again. And it doesn't mean that the hydrosalpinx will not reform or reaccumulate if drained. So in those circumstances, considering these facts, it is best to just perform something called a salpingectomy, which is unfortunately necessary in the majority of conditions when we diagnose hydrosalpinx, and that's the surgical removal of the affected fallopian tube, which is obviously, in case of severe hydrosalpinx or tubal damage, it is the only surgical solution. Another treatment option for the condition caused by hydrosalpinx, which is the major condition caused by hydrosalpinx, is actually infertility. So a treatment solution is IVF. And again, IVF is a very commonly utilized treatment approach for all women that have hydrosalpinx-related infertility because it bypasses the fallopian tubes. Now, in a woman that does not want to conceive or has a newly formed, newly diagnosed hydrosalpinx that's very mild, antibiotic therapy might be necessary. Antibiotics may be prescribed to manage an infection that can contribute to hydrosalpinx formation, especially when we know that there's a microbial factor involved. We have an elevated white blood cell count, we have some pain, we have other signs of inflammation. And last but not least, pain management. If we have a chronic hydrosalpinx in a woman that no longer wants to get pregnant, we don't need to operate. This is a tiny, small-filled fluid tube. We just leave it alone. If there's a little bit of pain here and there, using something like ibuprofen or Advil or other pain medications can help alleviate the discomfort. So if a woman is young and is fertile, it is essential that if she is diagnosed with hydrosalpinx, she needs to consult with a reproductive specialist or a gynecologist experienced in fertility care to determine what is the best treatment approach based on their unique circumstances, based on her overall health and her reproductive goals. And obviously, in such cases, a very timely intervention and a comprehensive management can help improve reproductive health and enhance the chance of achieving successful pregnancy outcomes if you have a hydrosalpinx. So the last condition that I want to talk about, it's number 3, ectopic pregnancy. This is one of the major issues caused by a blocked fallopian tube. It's ectopic pregnancy. And this happens when a fertilized egg does not make it to the uterus, most of the time due to a blockage, or sometimes just because the tube propelling function is too slow. And the fertilized egg will simply implant inside the tube. The tube does not have the ability to allow the egg to burrow and develop a large placenta. It will simply start bleeding, fill with blood, and rupture, causing a ruptured ectopic pregnancy. And sometimes this is the only sign and symptom a woman will get. She starts hemorrhaging internally and develops severe abdominal pain and then feels weak and dizzy, might actually faint, and needs to be taken to the emergency room and have emergency surgery. Again, the fertilized egg cannot survive outside of the uterus. What is interesting is a fertilized egg can implant in lots of places, even on the omentum, which is the little fat tissue that drapes our intestines. It could implant in the ovary. It could implant in a small fragment of the tube that is right at the top of the uterus, which we call the cornual region of the uterus. However, in all these places, we need the placenta. The placenta, it's a very unique organ that needs to have a surface where it allows the development of this excellent blood communication between the baby and the mom. And the placenta is the baby's lungs, the baby's liver. It functions as a respiratory and detoxification organ for the baby. And it's very important that it's actually in the uterus. So an ectopic pregnancy can be a life-threatening condition if it's not detected and treated promptly. So to end here, female fallopian tubes, as a conclusion, are essential for the reproductive process. they're very vulnerable to a lot of pathologies and a lot of disease that obviously can affect a woman's fertility and her overall health. So it's very important if you're a woman to be aware of the potential problems that could be related to your fallopian tube and seek medical attention if you experience any symptoms or concerns that I mentioned in this episode. Again, I will dedicate another episode on endometriosis, so I won't talk too much about endometriosis of the fallopian tubes. But in our next episode, I'd like to address a little bit what the tubes and the ovaries do after menopause. Because yes, these tubes are very important while we're young and fertile, but what do they do and what happens to them after menopause? There are problems, and I want to talk about them in my next episode. Thank you for listening, and I will see you next week. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.